Welcome back to Health District Television, brought to you by the Southern Nevada Health District. As we reflect on the district's 50th anniversary, a look at the history of the Office of Public Health Preparedness contains a list of events linked to the community's character today. Here's Jennifer Sizemore with the timeline.
Many people think preparedness only really came into being after the tragedy of September 11, 2001, but that's not really true. Public health has always had a role in planning for emergency and natural disaster responses. The events of 9/11 added terrorism to the existing mission and brought it much more into the public's thoughts. Prior to September 11th, our community faced emergencies and natural disasters. The Health District often played a prominent role in the response, from the MGM and Hilton fires of the 1980s to constant responses to flash floods in the days before the formation of the Regional Flood Control District. Public health is always focused on emergency planning and the possibility of dealing with mass casualty events. Jane Shunney has been with the district for more than 30 years, much of it in the emergency management field. She served as Dr. Ravenholt's liaison for EMS to local hospitals until his retirement. Jane also served as the assistant to the Chief Health Officer under Dr. Donald Kwolek and, at his request, established the current Office of Public Health Preparedness. What may surprise you is that through Jane's eyes, 9/11 was not the seminal moment for public health preparedness. Before September 11th was Y2K. The end of the 1900s, with all of its uncertainty and threatened computer millennium bugs, is what really motivated public health professionals to prepare for the unknown.
I think a big change began here in public health in 2000. And prior to that January 1st date, what we did in this community was significant, I think. It was a time of, we knew there was going to be a big deal on the Strip, going to be thousands and thousands of people here for that holiday, and we began to prepare for that event. And Dr. Kwolek and Mike Smith from AMR, but he came to me and he said, you know, we've really got to put some things together on that Strip for New Year's Eve.
Because the district regulates EMS, including licensing and certifying ambulance companies and fire departments, it's always played a role in the community's mass casualty planning. But Y2K required a different plan of attack.
We gathered together with the ambulance companies and fire departments and the hospital emergency rooms, and we planned for that New Year's Eve event. And what we did was unique because we set up casualty collection points on the Strip. We had tents and we had staff in those tents on the Strip, physicians and nurses, paramedics, and we wrote protocol to take care of certain kinds of injuries on the Strip. And then those that could be taken care of there were taken care of. Those that could not be taken care of there were sent on to the hospitals, because we anticipated that there would be all kinds of craziness, as there always is, on New Year's Eve on the Strip. And that was a first. And that brought together this community in a way that I had never seen before. We were all involved, fire, metro, public health, and the hospitals. And we put that plan together, and it went very well.
While New Year's 2000 did go well, there's no denying the events of September 11th, 2001 permanently impacted public health preparedness.
So it sobered us, as Dr. Ravenholt would say. It was a sobering experience. And it began planning at a minimal level, not thinking too broadly, I don't think, immediately after that. I think we were all in too much shock. And then, shortly after, we had all of the anthrax scares through the mail. And that affected our community, because we had people scared to death to go to their mailbox and open letters. And as a response to the anthrax situation, we in public health became aware of being trained or educated along with emergency management people, along with fire, along with metro, along with ambulance, EMS services, by going to training at Emmitsburg, Maryland. And this was a real eye-opener for how public health fit in with homeland security plans, with with the national preparedness goals, and it was a whole new phase of where public health fits into a community.
Our staff, in conjunction with colleagues from other agencies, regularly attends training in Emmitsburg, and while no agency can foresee every disaster or eventuality, the skills, the mindset, and the detailed organizational abilities honed in those classes serve as a foundation for effective disaster management.
Our mission statement is to prepare for, respond to, and mitigate the consequences of a public health emergency within Clark County, including those that occur as a result of a terrorist act. And so what public health has done is to prepare us to respond, and not only our agency to respond, but to begin to work with the community to respond.
Involving the community is critical. From educating residents to have an emergency kit and an evacuation plan, to relying on other agencies and businesses to step up during a crisis, it is all critical to a successful outcome.
Public health has developed partnerships with people we didn't really have partnerships with before, in particular the Resort Association or the Resort Corridor.
During the MGM fire in the 1980s, Dr. Ravenholt credited Bob Forbus, then head of Mercy Ambulance, and also a member of the school board, for his quick thinking that resulted in a solution for evacuating the hundreds of healthy fire survivors from the immediate scene. Forbus called for school buses to transport them to the safety of the convention center.
You may not plan for the thing that really happens, but you've gone through a process of putting that plan together. You've worked with your partners within the community. I know the guys from Metro. I know the guys from the FBI. I know the people from the different emergency managements, the different jurisdictions. You know, we all work together all the time. We know each other's face. That's a big deal in a disaster. When you can pick up a phone and you know the person that you're talking to at the other end of the line, that's tremendous.
But we saw the tragedy of Hurricane Katrina, the devastation in Joplin, Missouri. Didn't those communities have disaster plans?
These people were all prepared. They were just as prepared as probably anybody in the country. And they did what they did, and they responded the way they did because they did have plans. And so I think that if you don't have plans, things are worse because you don't have plans.
Preparedness is a dynamic, evolving field. Professionals from multi-jurisdictions are constantly training, conducting drills, and revising plans as new information and technology becomes available. And realistically, they are aware that sometimes, whether Mother Nature's hands or those of a terrorist, the sheer scope of a disaster may overwhelm any system.
But you know, when you are overwhelmed, at least you know that you've had some kind of an organizational plan to do something, and that's what you, I think, fall back on.
Each of us can help with disaster preparedness by learning how to protect our families and ourselves with a little advanced planning. Information on how you can prepare for anything like a short evacuation caused by a gas main leak to major disaster is available for free on our website or by contacting the Office of Public Health Preparedness.
It's hard to keep people motivated to think about being prepared for an event that isn't a pleasant thing to have to go through. It's a challenge to public health, but you know, one of the things about public health is we're very patient. It takes a while to change behaviors, and we just don't give up trying.